I'm Danielle, doula and perinatal mentor in the Mid-Ohio Valley. I get asked the question of what can I do for relaxation? Relaxation is about getting your mind in the right place. It's not something that you have to actually learn a specific technique for birth. So there's not a certain technique that will get every mother through birth. You will typically develop your own rhythm, your own ritual relaxation method when you're in labor, regardless if you've practiced anything or not. If, however, you already have relaxation techniques that you just commonly use, you're driving down the road, somebody makes you angry, you take a deep breath, you count to 10, that's one method. Somebody rubs your back when it doesn't feel good, that's another method. You listen to audio tracks, visualizations, and that helps to distract yourself or to think about these labor sensations as something different than a negative perspective. Every single mother is different. I hated relaxation practice whenever I was pregnant. I didn't like it at all, so I didn't do it, and I didn't need it because my body naturally worked through those sensations because I was in a supportive birth environment. You need more techniques if you're in an environment that is not supportive of biological birth. So thinking about that, you want to first select a care provider and a birth location that supports not just your view of birth, but actually supports the physiology of the birth process. You might really like your care provider, but the birth location that care provider works in might just do stuff to you all the time. And whether you think that's safe or not, somebody doing stuff to you during birth can be very difficult to relax through because it's constantly having somebody touch your belly, moving a monitor, touching a screen, or talking in and out, in and out, in and out the door. And you can hear me describe that, and it's kind of like, whoa. Well, imagine being in labor and possibly not really feeling that great and having somebody do that to you as well. So picking a birth environment and a care provider that mesh together with your biology, that's what you're looking for, and that actually increases the safety of birth. So the tools don't increase the safety of birth in most situations. There are situations where, yes, it's nice to have that immediately, but that's pretty rare. And other things typically happen with your hands, with the care provider's hands. Now, of course, that depends on their experience. You want to find somebody that knows how to use their hands. But working through labor is first having that environment that supports your body. So if you're comfortable pooping in a bathroom with the door closed, and some women have their feet up on a stool. Some people take their clothes off when they poop. So there's things that naturally relax you. And then somebody tells you, I'm going to poke your belly for 20 minutes every hour, and I'm going to come in, I'm going to talk to you, and you're going to poop right here in the middle of the floor. How do you think that might work out for you? Some women they just go through it and they do it and it's not that big of a deal. Other women are incredibly hindered by this. And other women have that fear that doesn't really kind of let them find that comfortable position. And then you need those extra relaxation techniques to work, through your labor. And every labor is different. So if you do relaxation practice during pregnancy, if you've not already had that developed in your mind prior to that, it just helps give you an extra tool in your bag to drown all that nonsense out and to help work through sensations that maybe you didn't expect. So relaxation practice can be anything. It can be simple, and really, if you can relax through an environment, maybe you've got 3 other kids running around, or there's a lot of stuff, a lot of noise going on. If you can relax through that, then you can bring that easily into a labor where there's probably going to be a lot of stuff going around for most women birthing in the typical birthing environment. If you do want a little bit more support, finding a birth class, hiring a doula to help work you through those techniques that maybe you forgot or you might need some suggestions for, that can be really valuable for you and your main birth partner.